Senior Source is brought to you by Synergy Home Care, Intrepid Home Health, and Southeast Texas Cardiology Associates.
In this week's Senior Source, Misty Knoll is here to talk about how a speech-language pathologist can be beneficial for people suffering from Parkinson's disease. So good to have you here with us with some advice. So tell us, how does this work?
So speech-language pathology, we cover a lot of different disorders, but specifically for Parkinson's, we're looking more at swallowing, voice and speech disorders. 80% may have some swallowing impairment throughout the process of this disease. Some first signs and symptoms they should be looking for is drooling, because as the process goes, they may have some slowing in their swallowing. Other things to look for are coughing, strangling during meals, difficulty chewing, food falling from their mouth when they're eating. And so our chief concern there would be aspiration pneumonia.
And so 89%, here's a statistic, 89% may have speech difficulty. Often they don't recognize it.
Yes, so a big part of what we do is to bring awareness to it, and also to work with the families, throughout this process, and to really try to get in there as soon as we can. The sooner we can get in, the better we can remediate the issue. So they really need to be looking for low volume and hoarse vocal quality in the beginning stages.
Yeah, that's some of the first symptoms that they need to be looking for. So look for the low volume. If you're hoarse vocally, then that might be a sign that you have this. And so again, you talked about how you can help. So when a patient first comes in, you sit down with them, and then what happens next?
We try to get the family involved. We do a lot of interview, of course, a medical history, really talk to the patient a lot and the family to see what their concerns are and their goals, and see what's meaningful to them. What's meaningful to them may not be the same goals that another patient would have.
And so you have ways to improve their speech, their articulation, and things like that.
Yes, voice and swallowing as well. And there is a program out there specifically designed for Parkinson's patients with voice issues.
And so do people need to be referred? Can they just call? How does that work?
If they want their insurance to cover it, they're going to need a doctor referral. So they'll need a doctor's order for evaluation and treatment from a speech pathologist.
And what is the website people can go to for more information?
The website for LSVT Loud, if they're interested in that voice program.
Okay, and we have that website for you right now on your screen. Go ahead and jot that down, and then they can definitely help you out if this is something that you're interested in, or if you want to ask questions, they can definitely get you situated there. So we talked about some of the first signs and then what people can do once they contact you. But this is a big concern for people, and it's good to know that there are programs out there for help.
Yes, and the sooner the better. So, and if they have any questions about it, just go ahead and ask for a speech evaluation. It doesn't hurt.
All right, sounds good. Thanks so much for stopping by today. We appreciate your advice.
All right.